motivated to make lifestyle changes and control my blood sugar. Is it possible to reverse or even cure type 2 diabetes with these changes? Or will I always have to manage the condition proactively?
Yeah, very good question. I keep getting asked this question all the time. And let me just make one thing very clear, that once you're a diabetic, still now scientific research does not support that there is a cure. But how do you manage it? Not by medication, you manage it by lifestyle. Just like I said earlier, you need to make sure your diet is a certain kind and your exercise is a certain kind. You check your sugars on a regular basis, and when you do that, you maintain your levels which are pre-diabetic or even lesser than pre-diabetic levels, and you make sure that you're not on any medications. You feel younger, you're healthier, and definitely lifestyle modifications can help you reverse your diabetes, which does not mean cure.
How often should I monitor my blood sugar levels? And what should I be looking for in terms of target ranges?
Blood sugar levels for diabetics, I would say, which is above 6.5% A1C, advised and recommended is every single day. And the best way to do it is fasting, I feel, because before you leave for work, before you go for your daily routine, it is much easier to stick to that discipline. And when you're accountable and you check your sugars daily, you definitely will be able to control what you do the same day. For example, if you ate something unhealthy last evening, or if you partied hard last evening and your fasting sugar is higher this morning, you can work on it the same day, not wait for it a week or so to get worse before you control it. So every single study in the last 100 years, I would say, shows that glucometer or daily sugar checking and being accountable absolutely helps you manage that diabetes wonderfully.
So on the same lines, are there any specific times of the day when it's best to check my blood sugar?
Well, it depends upon what level of diabetes you have. If you have a mild diabetes, which is low ranges of diabetes, I would say just checking a fasting is enough. It does reflect the last 2 meals that you had. But if your diabetes is moderate or a severe kind of diabetes where you're taking medication or insulin, I would recommend a pre-meal and a post-meal, at least 1 meal a day check. Pre-meal would be just before a meal, and post-meal would be 2 hours after a meal. People who are on insulin sometimes end up doing multiple times a day, and that is according to how your doctor wants it. So I would not leave that down here. But multiple checks are needed because you can get hypoglycemic and hyperglycemic, and insulin. People who take insulin actually need help with hypoglycemia, and more checks are required.
I'm concerned about experiencing episodes of high or low blood sugar. What are some practical tips or strategies I can use to prevent these episodes from happening again?
So you're absolutely right. People with diabetes have hyperglycemia, which is actually not as dangerous as hypoglycemia. And hyperglycemia can be avoided by making sure your diet is low in simple carbs, fruit juices, sodas, and anything which is sugarated, making sure you're on complex carb, fiber, protein. Now, hypoglycemia, on the other hand, is something which can be easily missed and is more dangerous, where the sugar levels fall under 70 milligrams per DL. Now, people on medications or insulin tend to get hypoglycemic if they do not eat appropriately to the medication they take. Checking your sugars and being aware of the symptoms of hypoglycemia is very, very important. And symptoms of hypoglycemia could be shaking or mild tremors of your hands, your sweating, weakness, dizziness. There are multiple blurring of vision. Be aware of that. Make sure you jump on it faster. If you're diabetic on multiple medications or insulin, carry glucose tablets with you or along with it, and make sure you take them. If you feel a symptom, check your sugars at that time and report back to your doctor as soon as you can.
Stay tuned for more informative sessions like this, and subscribe to our channel for expert perspectives on all things diabetes.